Hi, my name is Flores, and today I'll be talking about the article, How Can Occupational Therapists Measure Outcomes in Palliative Care? So the objective of this paper is to identify an outcome measure for occupational therapy interventions with palliative clients. So palliative clients are basically clients who are receiving treatment to control symptoms of their illness, which is non-curative. Interventions that were used included prescription of equipment, home assessment, coaching in personal and domestic tasks, education and strategies for symptom management like pain, breathlessness, fatigue, relaxation and stress management, which is coping with losses or uncertainty, and facilitation of social and leisure activities and information and support for the client. Another important point is the sample of the study included literature search results and 16 quality of care review papers, 2 books, and 59 research articles involving participants. So the type of characteristics that we would need in a client is to be in palliative care would be terminally ill clients that have maybe stage 4 cancer, nearing end of life from HIV, no longer responding to treatment. The treatments would include, like I said, pain management, and they would have symptoms of pain, depression, weakness from bedbound. We would do lots of ADLs, IADLs, especially for strength training, as the people that are usually terminally ill are usually bedbound, so they need a lot more intervention with their strength and range of motion. So for example, one of the interventions that was described in the article were coaching with personal and domestic tasks. So as you can see, I have some things here that I would use for intervention with clients. This is for ADLs with brushing teeth and maybe spitting in this. If they weren't able to, due to their lack of arm strength, brush their teeth, if you had an adaptive equipment at the clinic, they usually have the adaptive equipment. You would put in a thinner thing like this, like a toothbrush, and you would put it in. I just got a sponge and I cut it in half, put a hole in. It's much easier to hold on to since there's more to hold and they don't have to grip as hard when they want to brush their teeth. That's another thing. For the toothbrushes, they're also bigger ones like this, and a lot of the toothbrushes you don't have to twist. You can just pop off, so they can grab the toothbrush, pop it off on the side of the sink. And a lot of the times these people can't walk to the bathroom or it's too difficult for them. You can just bring them a cup to their bed, have them get a bowl, have them brush their teeth, spit in here, water, spit, and so forth. And with the toothbrushes, sometimes clients that are a little older have got pain in their gums. Since they have so much pain already from their illness, there are such things as a soft toothbrush. Like I said, it's a little harder for them to hold on to things due to the lack of strength from sometimes being bedbound. So for their eating ADLs, you can also get another adaptive equipment for their forks and knives. These are easier to grip since there's more surface. This is just a cut up sponge. I put it in and I drilled a little hole with a scissor. I feel like the most important thing you can do for someone who's in palliative care is be there for them, talk to them, find good ways of stress management. If family isn't able to visit due to circumstances like COVID, you're able to FaceTime your clients with their family and have that be an intervention for that day, and maybe have them, tap the phone, call their family on your phone or whoever's phone, but have them hold the phone, maybe call their family to FaceTime to talk to them, see their grandchildren and such. A lot of the times also these clients will be in a lot of pain Typically, they already have prescribed medication for their pain, but things you can add on to that are cold packs, hot packs, things like the really heavy-duty Vicks. And even though they're in pain and they're in discomfort while they're moving, you can still move them a little bit so they get used to the motion and start doing things more on their own. I feel like with this type of intervention, it would help their passing, or hopefully, you know, sometimes in these palliative cares, they do get better, which is not always happening. It's pretty rare that happens, but the only thing I expect from my interventions with the ADLs, IADLs, of brushing teeth and eating, being able to eat, is that you still give them a good quality of care and they still know that they're independent, they can still do the things they used to do. A response that you expect to get from people who are terminally ill is that maybe they're still pushing and fighting that battle. They're able to still brush your teeth, they're still able to eat, because eating is the most important thing to have energy. They're able to manage their pain. And that's it. Thank you very much for listening. Thank you. Bye, Dr. Kokesh.